All right, next question. How long does brain fog and forgetfulness last? I've been operated on 2 times, and it's been over 15 years. When will I get better? This is a question that I want to know too. And
so the answer is it depends. It depends. I would say for most people, you can expect to see improvement over the course of weeks to months. When you're having cognitive changes that are lasting well beyond a year, that is an indication that likely they will be long-standing. Having long-standing cognitive changes doesn't mean there cannot be room for improvement. And a lot of times it is assumed that, you know, if a person was had head scans while they were hospitalized and it didn't show any obvious sign of a stroke or an anoxic brain injury, that they definitely don't have it. That is not actually the most sensitive way of diagnosing that. You can still have an anoxic brain injury without there being obvious signs of ischemia on imaging. And when you have long-standing cognitive changes afterwards, oftentimes the massive fluctuations in blood pressure that can occur right at the time of the dissection or the surgery itself or in the complications afterwards, that can be a reason why. When I say it's likely to be long-standing, but there's still potential for help, we kind of go back to the question a few times ago of, like, what do I do about this irritability? Talk to somebody. There, you can do detailed neuropsych testing to kind of try to tease out, like I have getting affirmation from across the room, figuring out, is the challenge that I'm having potentially a manifestation of a mood dysfunction like depression, anxiety, sensory overwhelm or processing dysfunction, or is it more specifically cognitive dysfunction? And if so, how do we categorize it? Can we figure out what areas of the brain are involved? And that information can be sort of directive in what do we do about it. Sometimes it might be therapy, maybe speech therapy or occupational therapy, to learn different strategies to adapt and accommodate for the deficit. Sometimes it might be medication, certain neurostimulants like Ritalin or amantadine or other medications that are sometimes used following brain injury can be helpful. Sometimes it might be psychotherapy, getting involved with psychology and processing that. Maybe also medications for depression, anxiety, or a combination of all of the above.
I just wanted to tag off of that, springboard, whatever the term. One of the hallmark diagnostic criteria for post-traumatic stress is an inability to recall specific events or specific portions of the event. So if that may be one of the hallmarks of what you're describing, that falls right into the post-traumatic stress diagnostic, if that makes sense.
yes, thank you.
Is this on? I have a PSA from the patient perspective. If you are a female and you are between the ages of 40 and 60 and you are perimenopause, premenopause, postmenopause, menopausal, and you have these symptoms of brain fog, there's also, my understanding, talk to your doctors because we are often dismissed. And our heart symptoms are often dismissed as menopause symptoms. Also, you're tired, you're raising children, you work all day, then you're home at night. We are talking about this more and more about women and cardiovascular health and the necessary conversation we need to have with our doctors. And this is another piece of advocacy. Do not take no. If you don't think that your OB, your PCP is not listening to you and not taking your symptoms seriously, please get another opinion. I had all these symptoms in my 40s after my diagnosis, but I didn't know if I was just being dismissed as menopause. So I now will never know, was it because I had an aortic stenosis and the aneurysm's not going to cause the brain fog, I don't think. It's the aortic stenosis and the lack of good blood flow to the body and to the brain. So please, that's my PSA. Don't give up if you are female and you are having these brain fog symptoms. It is a key symptom of aortic stenosis, or it can be. Thank you.
Thank you, Robin. I want to thank everyone for attending today. Thank you to, obviously, all the providers and speakers that were here today. Thank you for attending. Thank you for all the great people and partnerships that we've made over the years that has helped make this possible.